And welcome to the 2023-2024 Annual General Meeting for the Western New South Wales Local Health District. I'd like to invite our Board Chair, Matthew Irvine, to welcome us to this meeting and to perform the acknowledgement of country.
In opening the meeting this afternoon, it gives me great pleasure and it's quite an honour to acknowledge First Nations custodians of the land on which we meet here on the outskirts of Orange in Wiradjuri country. And in doing so, I pay my respect to elders past and present and acknowledge the emerging leaders in our community.
District's annual public meeting for 2023-2024. Thank you for joining us. You'll shortly hear from our Chief Executive, Board Chair and the Executive Director of Finance and Corporate. They'll provide you with reports on the activity and performance of the LHD over the last financial year. An annual public meeting is a legislated requirement of all local health districts, but it's also an important opportunity for our health service leaders to engage with you in all our communities to create a shared understanding of what we do and how we do it. At the conclusion of today's meeting, we'll have some time for questions. You can post these at any time during the meeting in the Slido tab of the meeting. Before we start formal proceedings, we wanted to provide you with some highlights of activities from the last financial year. Each of these projects not only builds on our strategic goals, but also maps back to Future Health, the roadmap for delivering health services right across New South Wales. Our district has a people strategy, which is a comprehensive set of measures we're using to support and grow our workforce, both in terms of size and of skill. In many locations, our permanent workforce is joined by temporary or visiting staff. Making our health services places where those members of our team choose to be is important, and this has been where our key health worker accommodation program has been instrumental. Being able to provide visiting or new permanent staff with a safe and comfortable place to stay helps make us an employer of choice. This financial year we delivered a number of projects in rural and remote locations to either acquire or build accommodation, and there's more to come. In 2023, we launched our first 5-year environmental sustainability strategy, outlining how our LHD contributes to the New South Wales Government's Net Zero plan. Our strategy identifies priorities in 6 areas: clinical care, products and services, waste, resources, infrastructure and transport. Reducing our energy consumption is going to be vastly assisted through the installation of the second largest solar PV installation in any New South Wales Government facility. More than 3,300 panels are being installed on existing infrastructure on the Orange Health Service and Bloomfield Hospital campuses, reducing carbon emissions by almost 2,300 tonnes a year. Our LHD aspires to be a leader in the support of clinical trials and to position itself as a partner of choice when clinical trial opportunities become available. Building that capacity is important for our services and staff, but more importantly, it gives patients living in rural areas more equitable access to clinical trials that could potentially improve their health outcomes and quality of life. Last financial year, we established the Western Cluster Clinical Trial Support Unit, a team providing centralised expert support and guidance to establish and conduct clinical trials in our footprint. Working with our clinical teams, other healthcare facilities and commercial sponsors, the CTSU will be instrumental in building our clinical trial capability. In 2022, the New South Wales Health Secretary provided a system-wide apology to the stolen generations for the role played by health services and facilities in past policies that have so devastatingly contributed to the disconnection of Aboriginal families, communities and culture. Our LHD has a strong commitment to reconciliation and to closing the gap. Replicating the apology across our services and sites was important to us to demonstrate, in perpetuity, that the wrongs of the past were acknowledged. We want our services to be places of respect, comfort and safety for everyone, and displaying the apology is one way we can provide that assurance to Aboriginal people who enter. From our largest facility to our smallest, each service hosted a community event welcoming Aboriginal people and other community representatives to witness the unveiling of almost 50 renderings of the apology across our district. Another component of our people strategy has been to build scaffolding around new graduates to support their entry to our workforce. Creating a fulfilling and enriching start can be instrumental in attracting new graduates and in keeping them as they forge their careers. The Allied Health Rural Graduate Program provides new allied health practitioners with a 2-year program that offers development and leadership opportunities across multiple disciplines and clinical areas. This year, the program supported 50 new allied health graduates across 8 disciplines and 7 sites, and previous evaluation has shown a retention rate of 80%. In 2024, the program received the District's People and Culture Award and is now a finalist in the New South Wales Health Awards, which are announced in late October. The Virtual Rural Generalist Service, or VRGS, is a well-established service that supports our smaller communities and our workforce with both virtual and in-person medical support. This year, this highly respected service took another step forward, expanding into 5 pilot sites in the Southern Local Health District. In addition to the locations supported in our own footprint, VRGS now offers 24/7 medical coverage in Braidwood, Yass, Bombala, Delegate and Cookville. Testing how the VRGS model works in other parts of New South Wales is an important evolution and another step toward validating how this innovative and effective model can support healthcare in rural and remote locations. The Southern LHD has submitted the expansion of VRGS to the New South Wales Health Awards, and it is now a finalist in the Patient Safety First category. Voluntary assisted dying allows eligible people with an advanced and progressive disease, illness or medical condition to ask for medical help to end their life. VAD was introduced in New South Wales in November 2023, and our district rapidly moved to establish the processes and services needed to receive, assess and progress submissions from residents. We've subsequently supported 16 clinicians to become authorised VAD practitioners. We've processed 52 requests, with almost half of those progressing to final assessments. Providing equity of access to VAD for people living in rural and remote areas is one of the more challenging components of this important healthcare service. Our response in Western is helping bridge that gap for our residents. For more information on voluntary assisted dying, please search on the New South Wales Health website or call 1300 802 133 during business hours. Providing care closer to where people live is a key component of our strategic direction. For people living in more rural and remote areas, the concept of a service arriving in your town on wheels has been commonplace for decades. The mobile library, the mobile dentist, for instance, live in many of our memories. And in more recent years, services like breast screen have been able to take more complex services on the road. However, before 2023, the idea of doing computer tomography, CT or CAT scans was a bit of a dream, but our LHD made it a reality. Our mobile CT, complete with large comfortable amenities, air conditioning and a reception area, launched in May 2023, and since then it has been performing well above the planned service targets. Rotating between Burke, Cobar and Walgett, the service has provided close to 1,800 scans and saved patients more than 750,000 kilometres in travel. Working to close the gap is everyone's responsibility, and one which requires coordination and goodwill as catalysts for change. Gukanji Nungu, recognised wording for Aboriginal women's gathering in the Barkindji language, was brought together by Aboriginal women elders from the Bourke area. It gathered people and services to yarn about health and other issues that affect their lives in a culturally supportive environment. Facilitating relationships with Aboriginal women who exert power and influence that is pivotal to the well-being of their community provides an incredible foundation to improve issues such as health literacy, service utilisation, and builds connectedness that can only be an asset as we work to close the gap. The Bourke gathering in August 2023 was well attended by close to 90 people, including the New South Wales Health Secretary, Susan Pearce, and will serve as a model for future gatherings, both in Bourke and in other locations. Surveilling disease and other health risks is critical information, particularly in a time and place where the early identification and response to outbreaks can so dramatically change outcomes for individuals and communities. Our Public Health Unit, working with our Strategic Reform, Planning and Partnerships team, identified how a series of ad hoc or separated data sources could be aggregated and delivered in a clearer, more comprehensible way, and this led to the delivery of the Public Health Analytics Dashboard. This information, delivered quickly and cogently, can aid our teams in making data-driven decisions, inform public health protection and public health responses. We can't underestimate the power of knowledge when delivered in the right way and at the right time. Perhaps the influence of the dashboard is best demonstrated in the appetite shown by other public health teams to see how this work can be adapted into their own settings. This snapshot has represented just a fraction of the activity and achievement across our LHD in the last financial year. As individuals and as teams, our workforce continues to do extraordinary things. There's simply no way to adequately describe how each interaction with each person who receives care makes a difference. No way to properly summarise how the imagination and innovation of our teams builds and strengthens our services. We encourage you to stay informed about what's happening across our district throughout the year. You can join us on social media, on Facebook, Instagram and LinkedIn. You can have your say on a range of issues under consultation by going to Engage Western. You can find news, information about services and career opportunities on our website. Thank you for joining the 2023-2024 Annual Public Meeting.
So great slideshow, thank you, Kath, for putting that together, and it's a great snapshot of the 12 months just past, and a few memories popping up there along the way as well. For my report today, just some very brief reflections on where we've been in the last 12 months. It was pleasing across the last 12 months to be able to get back to our practice of taking our board meetings to locations all across the district, and in the past 12 months we've managed to have board meetings in places including Grenfell, Coonabarabran, Dubbo, Mudgee, Bourke, Coolah, Bathurst, Warren, Condobolin, Orange, Narromine and Blaney, which is a great example of the board getting out into the communities and in each of those locations meeting with local stakeholders and staff at our hospitals and MPS facilities. It was great as well to see across the year some significant progress made on a number of large projects. Back in February, we saw construction begin on the Cowra Hospital site, and that's been a long time coming for the community there. And it's great to finally see tools in the ground, and we're imminently waiting work to commence in Blaney, as well as that significant planning inroads being made in the redevelopment and upgrade of Bathurst Hospital as well. So those projects are things that we're all keeping a very close eye on at board level. And that's in no small part to the efforts of Mark and his team on the ground here in the region, but also our colleagues at Health Infrastructure and also out of the Ministry in Sydney. I do want to acknowledge the contribution that Mark and his senior leadership team have put in over the last 12 months. as is openly acknowledged across the state, finances in government are tough at the moment and will be for some time, and all agencies have been asked to very carefully watch their budgets, and I commend Mark and his team for the work they've done in that space to be fiscally responsible, as well as at the same time making sure that we continue to be able to deliver the services that we need. I would also just like to acknowledge the efforts of the board, the board that, along with myself, support Mark and their leadership team, and also provide a link through to the ministry. We've got a great team, we've got a very balanced team, everybody's really stood up over the last 12 months and has made a significant contribution. I will single out a couple of people for special mention because towards the end of the year, their terms on Western New South Wales Health Board will come to a close. Firstly, Amanda O'Brien has been a part of the board for almost 10 years, and at the end of this year will mark her 10-year anniversary. And of course, under the rules that govern how these boards are constituted, Amanda is not therefore eligible to continue to serve, and is going to move into a very well-earned retirement from her role with our board. But her contribution over many, many years has been outstanding, particularly bringing her experience as a clinician into the boardroom. I'd also like to acknowledge Fiona Bennett and Jason Cook, who will both hit the 8-year mark at the end of this year. Both Fiona and Jason bring a significant experience and capability in financial literacy and financial oversight to the table, and their contribution will certainly be missed as well. Jason and Fiona have indicated that they won't be seeking an extension of the 8-year limit as permitted rules of operate. So to those 3 very important board members, thank you very, very much for the contribution that you've made. You are leaving some rather large shoes to fill, and that process is underway as we speak. That about wraps up my report. I can hand back to you, Kathy. I think to come back to Mark for his comments. Thank you.
Thank you, Matthew. And I'll hand over to your presentation. Mark, if you can just let me know when you'd like to advance a slide.
Thanks, Kathy. Next slide, please. So I'll just touch really quickly on our communities, our activity and performance, our priorities and the challenges at a higher level that we face across the district. I'll touch briefly on our patients and some of the things that our patients are telling us about the services that they receive. I'll talk a bit about some of the new models that we're using to engage our communities, about our staff, and some of the service improvements that we're focusing on. And then finally, I'll talk about some of the key goals that we've got in the 24-25 annual plan that we're working through. And then I'll hand over to Peter Bonington, our Chief Financial Officer, to take us through last year's accounts. Next slide, please. I would also, like Matthew did at the start of the meeting, like to acknowledge that we are meeting today on Wiradjuri country, and to also pay my respects to elders past, present and emerging. Next slide, please. Next slide, please. So our district is larger than the state of Victoria, and it has a higher population than the Northern Territory. And both of those are statements that really define who we are as a district. So we've got a very dispersed population, particularly in the northern part of our district. We cover a wide range of local government areas. We've got a large number of facilities. We've got 38 healthcare facilities that have an inpatient capacity, but as well as that, we have got 50 community centres across the district and a wide range of community mental health and drug and alcohol services, including some statewide services, one of their kind, on behalf of the entire community of New South Wales, that are delivered from the Bloomfield campus here in Orange. I'd also like to acknowledge that compared to the rest of New South Wales on average, we have a much higher proportion of our population who identify as First Nations people, and that's incredibly important for the district. Next slide, please. So essentially, our population is both older on average than the rest of New South Wales, and it's also ageing more rapidly than the rest of New South Wales. In contrast to that, we also have a really high proportion of young children between the ages of 5 and 10 years compared to New South Wales as a whole. And that contrast between young, emerging members of our community and a rapidly ageing community will really set the strategic priorities for our district as a whole. It's also true that our community really struggles with a whole lot of behaviours and lifestyle choices that we make collectively together that mean that our health in the long term is at higher risk than it is for most other people who live in New South Wales. And we really have to work harder as an organisation and as a community about how we come together and tackle some of those factors that mean that our lives are more risky than the lives of others. Next slide, please. In the last year, we've seen about a 5% increase across the district in terms of emergency department presentations. And we see on average about 581 people across our footprint ending up in our EDs every day. And that's a really big operational challenge for our organisation. We have a really good average length of stay in our facilities compared to New South Wales, other hospitals in New South Wales on average. We've seen a really significant increase in elective surgery across the last year, particularly as we put a lot of effort into catching up on the backlog of people on the wait list as a result of the pandemic. And we've also had just short of 3,500 new babies delivered in the district in the year that's just finished. Next slide, please. In terms of outpatient services, we've seen about a 4% increase in outpatient services, and we see just over 2,500 people throughout various outpatient clinics across the district every day. Over 13% of outpatient services these days are delivered virtually, and that's having a real benefit for those members of our community who no longer have to travel vast distances in order to have relatively short interactions with people in an outpatient clinic where it's safe and appropriate for that to occur. We have a really active oral health service. Around about 470 people every week come through our service, and Western New South Wales Oral Health Service has piloted an entirely different way to manage the wait list to make sure that people receive their oral health care much more quickly than they did in the past. And that work has been so successful that as of next month, the way that wait lists for oral health are managed right across New South Wales will change to the Western way. Next slide, please. We have in our strategic plan 4 key goals that we're trying to achieve, 4 priorities. They are to improve the health and wellbeing of the people who we serve in the district that we serve, to make really meaningful gains in Aboriginal health, to deliver world-class rural health care, and to work as one service across many places. And those are worthy aspirations for us to have. As a local health district, early in 2025, we'll be revisiting our strategic plan and working with you as our community to determine what our priorities should be for the next 5 years moving forward. Next slide, please. We have some really pronounced challenges, and amongst them include building a strong and sustainable workforce for the long term, how we respond to and address the increasing fragility of primary care in our rural communities. As I've said before, how we respond to the needs of our ageing population and the increasing complexity of their healthcare needs. How we address the changing populations in some of our communities, and particularly in our district. Some of our larger towns are set to grow by a significant percentage over the next decade, whereas some of our smaller towns are set to decline by significant numbers, and that brings some challenges all of its own. We want to be innovative and to develop new ways of delivering care. And we also want to make sure that the challenges related to the environment across a district like ours are well managed and that we've got a proactive response to the issues of climate change. Next slide, please. Next slide, please. Our patients, on average, rate our services really highly. And in most measures across New South Wales, we ask the people who use our services what they think about them. The services in our local health district get higher praise from our community and the people who use them than is the average for health services across New South Wales. That won't be everybody's experience, but it's something that we put an enormous value on and something that we strive to do to make sure that the human experience of having to interact with the services that we provide with the health professionals who deliver care to you is as good as it can possibly be. Next slide, please. Next slide, please. Last year at our APM, we talked about some different ways we wanted to engage more meaningfully with our communities so that you could influence our direction moving forward. And over the last 12 months, we've moved ahead on a number of the things that we said we would do. We've launched our Engage Western New South Wales community consultation platform online. We've put 41 projects through that process and a wide number of surveys. We were allowing members of our community an easy opportunity to have their say. We had a community conference last year, and in a couple of weeks' time, we're about to have our second version of a community conference in Dubbo, and you're all invited to attend that conference. There are details about it that are available online, and we particularly want to focus on mental health services in many of our communities for vulnerable people as we come together as a community later this year. We have also piloted 2 sub-regional health planning committees as a new way to interact with those of you in our communities who are interested in our services to get some really authentic engagement in local projects happening. And in the 24-25 year, we'll extend that to a 3rd sub-regional planning committee in the Warrumbungle Shire as we progressively move from one end of the district to evolve how it is that we engage with you, those of you who live here. Next slide, please. We want to, where we possibly can, we want to authentically work with you to co-design our communities. But these are just 4 of a number of examples where we've been able to progress that in the last 12 months. Supporting vulnerable communities around vaccination clinics, doing some co-design of health education processes so that those who are ageing in our community can age well, and those who care for them, members of our community who care for older members of their families, are well equipped to do that. We put a lot of effort into improving the orientation and training that we provide and make available to our volunteers. And we're also working very closely with members of our community who have intellectual needs and disabilities or abilities that are different than other people, and really focusing on how we can deliver different models of care in ways that meet their particular needs. Next slide, please. Next slide, please. We have around about 8,500 staff in terms of numbers of individuals who work for us, or in terms of full-time equivalent, that's just over 6,000 full-time staff equivalents. Most of those staff are permanent in our district, although we do have, because we have a number of fixed-term or temporary contracts for services with different organisations, including particularly the Commonwealth Government, we do have a large number of our staff who work on temporary contracts. And that's something we're looking at really closely because it's important to us to be able to provide as much certainty as we possibly can to the people who work for us. The vast majority of our staff work in nursing professions, but because we run a broad number of facilities, and in each of those facilities, and in the vast majority of them, we also provide our own food services on site, our own maintenance and ground services. We have a wide range of what we call enabling staff, who also support our clinical care delivery. Next slide, please. We currently have, right across New South Wales Government, there's a survey of all of our staff and others who work for the government around what it's like to work in an organisation like ours. And that survey has just completed. Over half of our staff responded to that survey, and we had a higher rate of response than for New South Wales Health as a whole, which we're really pleased for. And in about 3 or 4 weeks' time, we will get the results from that survey, which we'll share with our staff internally, and will help us focus our work with them to making sure that our organisation is a great place to work, as judged by them from their perspective. Next slide, please. Next slide. Just quickly touch on some of the service improvements, and thank you, Kathy, for the slide intro right at the start of the meeting, which talked about some others. These are just a few of a vast array of things that we could have picked. We've done some work upgrading and improving some of our MPSs to make them more friendly environments for the older people for whom they are their home. And we hope to continue that work in other sites this year. We have a number of nurse practitioner positions that were created across the district, and particularly for nurses who are on a pathway of study and work to transition in a couple of years' time into nurse practitioner roles. And one example of that are 2 positions that were created at Orange Hospital, working in either the emergency department or ambulatory care. In our district, so right across New South Wales Health today, there are 150 vacancies for psychiatrists. That's part of a global shortage or a global workforce problem. But I'm really pleased to say that in our district, we have 14 trainee psychiatrists working with us either in Dubbo or Orange on a pathway to become the future specialists in psychiatry in the years to come. And we're really pleased that they have chosen our services as a place to train to meet the needs of rural people. And I also am really pleased that we have been able to, this year, to extend our high-risk foot clinic so that we have a clinic that operates in the southern part of our district. We've had one that's operated out of Dubbo for many years, but this year we've started a similar process for those who live in Bathurst and Orange in the southern part of our district, and we're really excited about that. Next slide, please. Behind the scenes, we've done a lot of work to improve the logistics of stores and supplies and all of those mundane things that are hugely important to making sure our services are delivered well. And my congratulations and thanks to the many, many staff who've worked behind the scenes to make our services more efficient and easier to use. We've been able to introduce e-referrals for outpatients between general practitioners and specialists in Dubbo for the first time, and that program will extend to other parts of our district during 24-25. And as we heard right at the start of the meeting, we've put a lot of money and effort into improving and expanding the accommodation that we have available for our health workforce, including purchasing some large facilities both in Orange and in Dubbo, so that we have more accommodation for those who come into the district to provide care to you, our community. Next slide, please. Our future. So we've got some major infrastructure projects, Laney, Cowra, Bathurst, Matthew talked about them before. By and large, all of those projects are well on track, and we're really excited to see them take shape. And for those who live in Bathurst, next calendar year, we expect to see the construction start, all going well, for the redevelopment of your hospital there. Next slide, please. We also have changes to facilities and developments working in other sites. So the palliative care, extension of our palliative care facilities in Orange, we expect to see take shape in the 24-25 year, and they're well advanced in the planning for that. The Canoundra Health One, which is being built on site with the local hospital in Canoundra, will take shape and be built this year. And we're really pleased that at last we have a development application in to build a residential alcohol and drug rehabilitation centre in Dubbo. Next slide, please. In terms of significant focus areas, I mentioned before in the 2025 calendar year, we're going to revisit our strategic plan and work with you, our community and our staff to recast our vision as an organisation for the coming years. We're also about to roll out the Head to Health Commonwealth program in our mental health, wraparound mental health and wellbeing services in Orange and Bathurst. It's a joint program that we are initiating alongside the Primary Health Network, and we'll be really excited in the coming months to see that take shape. I talked about ongoing developments in our NPSs, and this year ahead, we are very keen to make sure that we're able to deliver on improvements in Nyngan, Warren and Lightning Ridge. We want to continue to develop our surgical services and cardiology and mothers and children's services across the district. And we've also been very fortunate to be one of only 2 LHDs in the state to be selected as the site from which to expand virtual urgent adult care services. So services that will assist members of our communities who've got an acute health need that they'd otherwise come to an emergency department for, but that might be able to be addressed in a virtual context with good communication and connections with community pharmacy and other services on the ground. And we expect to have those services up and running going early into the 2025 year. Next slide, please. Next slide, please. In terms of the annual plan for the year that we've just finished, we've achieved and met most of the things that we set out, as said we would set out to do, and many of those pieces of work will be ongoing in the current year. Next slide, please. In terms of our priorities for 24-25, we want to make sure that we continue to make improvements in how we manage our elective surgical waitlist right across the district. We're experimenting along with some of our Archer or Aboriginal First Nations services in the community about how we create shared workforce models. We have some examples of that already up and running in our mental health space, particularly with the AMS here in Orange. Got a number of commitments about how we improve the health of First Nations people that we want to deliver on. And this is the final year in 24-25 in that major 3-year people strategy that we commenced a couple of years ago. And we want to make sure that we deliver on that strategy and our commitments under it. I've talked about a number of the capital infrastructure projects we have underway, and we are working really hard to make sure that we deliver them on time and on budget and getting the outcomes that we expected. We have a significant expenditure review underway, making sure that we're spending your money wisely, and in particular, that we're making sure that we're focusing our efforts on making sure that our spend on delivering clinical services is where it should be. We want to focus intensively on the issues of cultural safety with members of our community, and particularly First Nations people, and how they access our care, and particularly in our emergency department setting. And we're putting a lot of work alongside the PHN and working with them and our communities in trying to develop a different and better model of health needs assessment about what you and our communities need, by making sure that we join up the Commonwealth perspective, the Primary Health Network perspective, the local health district perspective and our community perspective in a much more authentic way. And in the year ahead, we're trialling something quite different to the Warrumbungle Shire, which people who live in that community will be able to participate in as the 24-25 year proceeds. Next slide, please. So I'm now going to pass over to Peter Bonington, our Chief Financial Officer, to talk about our finances.
Great, thanks, Mark. As Matthew alluded to earlier, and Mark had in the slide deck, the fiscal context is one of the challenges that the LHD is currently dealing with, and that's reflected in the financial results for the 23-24 financial year, which are as follows. So a $43 million unfavourable variance to budget for our expenditure, $3 million favourable result to budget for our own source revenue, and $11 million favourable result to budget for what is our National Health Reform Agreement or activity revenue. The quantum of the unfavourable expense result to budget has not been experienced by the LHD for several years. Primary drivers of that result include the escalating premium labour cost and volume in both our medical and nursing professions, with above award contract rates required to attract and retain temporary or locum staff across many locations. The impacts of inflation across various goods and services expense categories, and demand-driven volume impacts across certain service areas. NHRA revenue is derived from the quantum of activity generated under our funding agreement or the activity-based funding model, and this year reflected an underperformance against set target, part of which we expect to rectify in the financial year 25 as a result of timing differences in activity capture and recording. The LHD once again received an unmodified audit report on its 30 June 24 financial statements. Next slide, please, Kathy. So our general fund expenditure has increased by 7.4% since the 22-23 financial year. The material uplifts occurred in our employee-related expenditure, up 6.5% or $45 million. Our VMO expenditure up 10.3% or $9 million. And our general operating expenses up 9.9% or $32 million. As alluded to previously, underlying escalation in premium labour costs was one of the major drivers of expenditure across these categories, with premium labour costs also impacting the operating expense category as well. Next slide, please, Kathy. Materially, our own source revenue was in line with prior year results, with some fluctuations between categories such as patient fees and user charges, as previously referred to, a slight overperformance to our budget. Next slide, Kathy. The financial results previously summarised have been experienced to one degree or another across many LHDs during the 23-24 financial year. Western New South Wales LHD is working through a financial sustainability strategy to return to a position of financial equilibrium over the medium term. This strategy leverages both expenditure constraint and revenue generation as a means to return the LHD to a balanced budget position. From an expenditure perspective, the LHD has embarked on its own comprehensive expenditure review program with focus on maximising efficiency in areas such as mitigating and reducing the reliance on high-cost premium labour in both the nursing and medical spheres, benchmarking expenditure and service efficiency across a variety of areas to ensure cost efficiency is being optimised, and ensuring staff rostering is fit for purpose whilst continuing to adhere to award conditions. The LHD will dovetail work with work being done centrally at the Ministry of Health to reduce system-wide expenditure in a variety of areas. The revenue or funding aspect of the equation will have a focus on working with the state on enhancing the engagement with the Commonwealth regarding the funding model for small, rural and regional hospitals that has been impacted in recent years by high cost of temporary labour and significant impacts of inflation in goods and services. Other areas of focus are listed on the slide. Overall, the LHD's underpinning financial governance structures remain sound, as evidenced by the unmodified audit report issued on the 30 June 24 financial statements. We're continuing to work on the medium-term financial sustainability of the LHD via the programs mentioned above. Thank you very much.
Thank you. Thank you, Matthew. Thank you, Mark, and thank you, Peter, for your presentations. Thank you very much, everybody, for attending. We will see you at the end of this current financial year. Thank you.
Thanks all. Good afternoon.
Thank you.